Tonight, the New Zealand AIDS Foundation talks about PrEP. Hi everyone and welcome. The new AIDS prevention medication PrEP has had some bad press this week after a man taking the drug was diagnosed as HIV positive. At this stage, health authorities are saying they need more information before they can make a definitive explanation. But PrEP, also known as Truvada, is at the heart of a new AIDS prevention strategy unveiled by the New Zealand AIDS Foundation this year. A few weeks ago, I asked the Executive Director of the New Zealand AIDS Foundation about their endorsement of PrEP. So Jason, welcome. Nice to have you here. I wanted to ask you about PrEP, or Truvada as it's also known. What are your thoughts on how effective this drug is?
Well, we know from clinical trial data that it's extremely effective. If taken daily as prescribed, then it reduces the risk of acquiring HIV by at least 92% and up to 99%. No HIV prevention measure is perfect. Condoms aren't, PrEP won't be, neither will undetectable viral load. But the trial data suggests that it's very effective if taken as prescribed. Of course, that begs lots of questions around what if somebody's not taking it as prescribed? What if somebody says they're taking PrEP but they're not taking PrEP? PrEP needs to be reserved, I think, for those men who really struggle with consistent condom use in the context of their sex with casual partners. And it's not a decision that should be taken lightly. It's a sexual health program, if you like, that should be negotiated with a clinician, where guys are getting regular 3-monthly screens for STIs, which PrEP won't prevent against. So again, it's a complex story, and I see our job as helping guys to understand that PrEP could be an option for some, but it certainly won't be an option for all.
I know times changed, but 20 years ago, almost 20 years ago, there was a massive stoush between the New Zealand AIDS Foundation and ACON, the equivalent in New South Wales, over negotiated safety, which had this level of complexity around talk and trust and test and so on. What's your personal perspective on whether that is truly manageable, that level of complexity?
I think the answer to that question is we don't actually have a choice. We need to step into that complexity, acknowledge that it's there, and have the conversations. There's no shying away from the fact now that HIV treatment has a role to play in HIV prevention. And even if the NZAF wanted to deny it, there is a stream of messaging internationally, globally, which says that condoms are not the only way to prevent HIV.
The last thing I really wanted to ask you is about Truvada itself, in terms of it is an HIV medication, and HIV is a very clever virus that mutates and has meant that earlier versions of medications are no longer as effective. Is that a danger with this?
Drug resistance you're referring to? Yeah, so a small danger. If somebody doesn't test for HIV before starting Truvada as PrEP and is in fact HIV positive, then there's a risk that resistance could develop. The other risk area is if they're not taking the pill as prescribed. So if they're not adhering to the daily regimen, over time the drug could develop resistance. If an HIV test is done before prescribing Truvada as PrEP, which it absolutely should be, and if guys are adhering to the medication, then the risk of developing resistance is very low.
Now, obviously, this is a complex issue and we don't have all the answers yet in terms of how the man on Truvada trial became infected. Since that interview, I've asked Jason Myers for an update. He replied that the New Zealand AIDS Foundation won't be making a public statement about the question of why the failure occurred because it has not been answered. He went on to reiterate that no HIV prevention intervention is 100% effective and that the opportunity to slow, stop and then reverse HIV incidence lies in implementing a combination of these approaches. And to my question around whether the New Zealand AIDS Foundation still stands by using PrEP, the answer is a resounding yes. Remember, each of us is responsible for our own safety, so take care. If you have a comment on this issue, let me know.